please introduce yourself and tell us a little bit about yourself.
So my name is Robert Conley. I'm a second generation veterinarian in Vernon, Texas. We have a mixed animal practice that's actually primarily food animal. We work on a lot of large ranches and all the way to small producers that have 1 or 2 cows. But we do a lot of different things. A lot of cattle, a lot of horses, and some small animal work too.
Where did you go to vet school, and how long have you been a practicing vet?
So I graduated from Texas A&M in 2006. I practiced for a few years in a bull stud, and then after that I've been basically here and a short time with the mobile practice in Bryan College Station, and here we are today.
Okay, so how did you find Nature's Formula products, and what were your initial thoughts?
So the products came to us to try. We were looking for something else to do for cattle that were off of feed and just didn't seem to feel well and do well. We got into some train wrecks with some pneumonias that just wouldn't respond to traditional therapies, and Nature's Formula products came to us to try, and we've been a firm believer and a strong user ever since.
And how long have you been using them within your practice?
We've used them since around 2015, so about 7 years.
All right, I'll start going through each product that you use, and so we'll start with Feel Right. How do you use it, and what have you seen by using it?
So Feel Right's one of the first products that we used. We use it in all of our surgeries, all of our bovine surgeries, and we do a fair amount of bovine surgeries. C-sections and GI disturbances and mummified calves and foot surgeries. We do a lot of food animal surgery. And in all of those cases, get a dose of Feel Right prior to or just after the surgery. And the thing that I like about it the most is those cattle stay on feed. They don't ever come off or come out of surgery and don't seem to go back onto feed. And so we have real good success with getting cattle out of surgeries, even major surgeries, and keeping them right on feed, keeping them eating, and keeping them going. So that for us has been the strongest use of the Feel Right is as an appetite stimulant in our stress cattle, as an appetite stimulant in our surgical cases. We use it there and have had very good success with it.
What's like a favorite story about using it?
So the first animal that we used the Feel Right on was a calf that had real severe pneumonia, and he hadn't eaten anything for several days really. He'd been up here, we'd been giving him traditional treatment, antibiotics and anti-inflammatories, but the calf just wouldn't eat. And so we treated him with 4 ounces of Feel Right, and it was like he immediately walked to a feed bump and put his head in the trough and started eating. And so my first experience with Feel Right has always been my best and my favorite experience with it.
All right, Lung Score. How do you use it, and what have you seen when using it?
Right. So Lung Score is another one that we adopted real early on, and we from time to time get into some respiratory train wrecks with some cattle up here. This is wheat pasture country, and we'll have some stockers turned out on wheat pasture. And from time to time, we've gotten into some wrecks with some non-responsive pneumonias or multiple drug-resistant pneumonias. Then we always have the occasional chronic calf that's just sick, and it seems like no matter what you do, they just can't make them better. And in those animals, we utilize the Lung Score. It's one of our go-to treatments for anything that comes to us that's had any antibiotics prior to being brought to the clinic for a respiratory issue. We just see a reduction in the difficulty that the calves have breathing. So it's got to free up the lungs in some way that allows them just to move air easier in and out of the lungs. And I think that's part of the reason why it's so successful in those chronic lungs that are just scarred and damaged from pneumonias. When we put the Feel Right into those cattle, they just have an easier time of moving air. And most, I mean, we've treated lots and lots of cattle that were, pulled and treated 2 and even 3 times with traditional antibiotics, and we still use traditional antibiotics. We just use the lung score in conjunction with that.
What's your favorite story about the lung score?
So it's about the same thing. We had one deal where we got into where it was just a huge, complete train wreck, and we had cattle dying left and right, and were non-responsive to antibiotics. We would run them through the chute early in the morning, and they would have 106, 108 temperatures. Some of them had normal temperatures. It was just all over the place. So we drenched all those cattle with Feel Right and lung score, and we got them back on the bunk. We just made it easier for them to breathe, and those cattle did remarkably well. They had lung issues. They were always going to have lung issues, but it wasn't nearly as bad as it was prior to the treatments.
Okay, MB1, how do you use it, and what have you seen with it?
So MB1, we use MB1 in kind of a different way than maybe what most people do, and what was put forth as a use of MB1. We use MB1 as an injectable treatment for tumors in large animals. We inject lid lesions on cows. We've injected some sarcoids on some horses, and have just had phenomenal success with the product. It's not recommended, it's not pushed, it's not anything else. We've used it in that fashion, and we've had really good luck with it. The eye lesions in the cattle, we just inject into the base of the lesion, and it doesn't cure 100% of the cancer eyes. And again, this is the most successful on the lesions that are on the eyelids. It doesn't cure 100%, but it does a very good job at causing those cancerous lesions to actually just core out and fall off. It does the same thing in the sarcoids that we've used it on. Just causes the lesions on the horses to just, they almost dry up and then become porous and then just fall off. And they're multiple injections a week apart. They require some anesthesia because the immediate injection is painful, but after that they're not. But that's the main way that we've used the MB1, and we've had really good success with it as such.
Have you used it as an antibiotic treatment at all?
Not enough to really tell you about. We've used it in conjunction with the lung score on some real bad pneumonias and things like that, and I don't dislike it for that. I just use it so much more for the injection of the lesions. That's my primary use of it.
And what's your favorite story about MB1? What's the most dramatic thing you've seen?
So the best story we have on the use of the MB1 is, again, injecting it into a tumor or a cancerous lesion on a horse. It was an aged mare. She was a brood mare. She wasn't particularly gentle. And the owners weren't interested in spending a whole lot of money on diagnostics to determine what kind of a tumor it was, but to surgically ablate the ear or remove the ear. And so we offered this as an alternative to euthanasia. And so we anesthetized the horse, we injected the base of the lesion, we let her up, we kept her here at the clinic for a week. We laid her down again in a week under anesthesia. We injected the base of the lesion, but that time it was porous. And so when we injected the lesion, there was actually holes where the MB1 leaked out, and that hadn't happened the first time. So we kept her another week, we laid her down again to inject it a third time, and that time when we went to inject the lesion, it slipped off of the ear with a divot where it had been in the skin, and it just wiped away clean. And it was probably the most amazing thing to me. I couldn't believe that it worked the way it worked. Now, we didn't know exactly what kind of cancer it was. It looked similar to a sarcoid. We suspected it was a sarcoid. We've used the product on sarcoids since then with similar success, but that one was by far and away the most dramatic use of the product that we've ever had.
Wow, yeah, that's a pretty cool story. We'll get into the horse products now. Equine Right, how do you use it, and what have you seen with it?
So we recommend Equine Right to the clients that we have that have rodeo horses or performance horses. Some of those are junior rodeos, some of them are adult rodeos, some of them are barrel racers, some of them are team ropers, calf ropers. We have a little bit of everything, and that we recommend that product to those horses, especially that are getting hauled a lot, just because it seems to take the edge off, the nervousness about the traveling. It keeps their stomach settled, it keeps them on feed, it keeps them on water. We just use it as a preventative in those horses that are hauled a lot.
And a favorite story about Equine Right?
It's just been favorable across the board.
Yep.
We've not used it in a single case where the people came back and said that just didn't do anything. Everybody that uses the product is reasonably happy that he stayed on feed, he stayed on water, she wasn't as nervous as she usually is in the box, or whatever it is. That everybody has just been very happy with the product as sort of a preventative care from traveling anxiety.
HHS, or herpes strangles product.
So we have a few barns that have racehorses that run in Texas and New Mexico and Oklahoma. Those barns, those horses come and go a lot. They're in training at the tracks. They're going from track to track. And historically, we always had a lot of problems with those horses, getting sick, coming home sick, getting the rest of the barn sick. And when we were introduced to this product and we started using it, that just stopped. And so we joke that we shouldn't use the product because it cost us a lot of money because we were treating a lot of sick horses. But that's just a joke. It's a great thing, and it just eliminated the illness in those horses. We would treat somewhere between 1 and 20 at a time, and we don't treat 2 a year anymore. So it's an excellent product in those horses that are at a higher level of risk for exposure to herpes, exposure to strangles, and it's just been an excellent product in our hands.
Got any particular favorite story with that product, or just in general?
Yeah, that one just tells for itself.
Yeah.
It's just such a remarkable difference in the product, or in the condition of the horses, and the consistency that they got sick, and then the next horse in the barn would get sick, and then it was 3 horses were sick, and then 5 horses were sick. And today it just doesn't happen. We just don't have the illness in the horses anymore.
EPM, our possum disease product.
So we use the EPM product. We see more and more EPM, probably because we're looking for it more than it's just not been here before. EPM is fairly common here in this practice area. It affects performance horses and ranch horses and backyard pets equally badly across the board. We use the EPM product every time we treat one. We put them on the EPM product and we put them on an anti-protozoal product in conjunction each other. I do not like the anti-protozoal by itself, but when we use the EPM product with the anti-protozoal, it's a remarkable treatment. It doesn't treat every horse, but we have a very, very high success rate, and we did not have that before we started using this product.
And with treating them, do you have to ever retreat them, or is it curing them?
So I think it's at least reducing the population of the bug enough that the damage is mitigated, and we don't seem to have to come back and retreat these horses ever, or at least we haven't had to do one yet. We've had real good success with putting them on one course of therapy, through the anti-protozoal and the EPM together, and it's just been very good in the one run.
Any particular story
So
stands out?
So one of the first horses that we used it in was a ranch horse that he was coming along real good. He was a young horse. He was coming along real good, and then he just kind of got off, and it was a real difficult horse to diagnose because he wasn't very consistent. He would be off a little bit, then he would be off a lot, then he would be off a little bit, and you'd look at him one day and think seemed like he was lame in the left front, and then you might look at him 30 minutes later and it looked more like the right rear. So he sent off, and it just continued that way it got to the point where you could take him by the tail and just pull him all the way to the ground. He had very little strength to stop you from pulling him down. So we treated that horse with the anti-protozoal and the EPM product together in conjunction, and that horse made a full recovery. He went back to ranch work full time and has made a really good horse for the ranchers. We kind of laugh. He kept one little funny quirk where he rolls his tongue, and he didn't do that before. So we're blaming that on the damage caused by the protozoal. But for where he was to where he is today, rolling his tongue funny is a totally acceptable part.
All right, and then the last product that you use and have experience with is skincare.
So we use the skincare. We use that a lot for cuts. We use it for skin sloughs. I like it on everything except suture lines. I don't like to use it on a wound that I've sutured shut. But for wounds that can't be sutured, they're too big, it's too spread out, a burn or a skin slough. So we've used it on skin sloughs from snake bites. It has been an excellent product. Speeds the healing, works really well. Been very, very happy with it.
Why don't you like it on the suture wounds?
There's something about it. It does something to the edge of the wound that keeps the edges from healing. And the wound is very healthy, but the sutures won't stick, and so it doesn't do well on a sutured wound. But anything that can't be sutured, too old to be sutured, in a bad location to be sutured, too big to be sutured, too much trauma to the skin to hold the sutures, we use it, and we've had very good luck with it. We've used that on horses, we've used it on cattle, we've used it on dogs, and we've been very, very happy with the product in those situations.
Any particular story with this?
So we had a dog that was bitten by a rattlesnake at the hock on the rear leg. We treated the dog for the rattlesnake bite. Dog did fine. Everything was good. Had a pretty expansive lesion. Actually sloughed the skin surrounding the whole hock. there was about a half an inch of skin that ran down the very most front of the limb, and that was all the skin that was left, and the rest of it was just completely wide open. And obviously nothing that could be sutured, nothing that could be closed, maybe skin grafts, but we made the decision that we would try the skin care on it, and that thing healed beautifully. That's been several years ago. Dog travels back and forth. He doesn't live in Vernon, but he travels back and forth pretty regularly to the ranch. And we saw him the other day, and has a little bit of scar, but it's not anything like it could have been. He did really, really well, and that's probably my favorite story of the skin care in a big healing wound.
Okay, so then of all the products, if you had to choose just one to use in your practice, which one would it be? Which one is your favorite, and what do you use the most?
So if I had to choose one to use, it'd be the Feel Right, because of the amount of surgeries that we do. We use it on every surgery, and I'm scared to give it up at this point. It's worked so good for so many years.
Okay, and then you would recommend it to anyone that has cattle, horses, these products you've used?
I do, yeah. We recommend them. We use them a lot in the clinic. We send them out with people all the time. I don't think you can go wrong with any of these. I'm sure there's cases where anything's not going to work and something would work better and this would do better than that, but for just across the board, these are excellent products, and we recommend them literally every single day. So we are firm believers in the products.
Thank you for your time.
Thank you.